right. Hello, everyone. So once again, my name is Evangeline. I'm the Alumni Engagement Officer. And today I'm pleased to welcome you all to our Development in Action webinar on the topic of from exclusion to impact, driving economic development through disability inclusion in Ghana and beyond. And I would like to welcome our speaker today, who's Commonwealth Alumnus Alexander Kojo Tetteh from Ghana. And he is a 2007 Commonwealth Professional Fellow who completed his fellowship in education governance from RADAR. Of course, I would let Alexander provide an in-depth introduction about himself, and really looking forward to the webinar presentation today. Please note that after the presentation, we will have a Q&A session, and we will also have a post-webinar networking session, which is an informal networking session which won't be recorded, but it's a great opportunity for you to network with each other and with Alexander as well, and connect and discuss the webinar topic, either, if you're working in this sector or if you're conducting a research in this sector. So yes, Alexander, over to you.
Thank you very much for this opportunity, and good morning, good afternoon, good evening, everyone. Thank you for joining this webinar. This webinar, I will be taking you through a few things as a matter of overview. We'll be looking at my life experience as a person with disability. We'll also look at some economic barriers and opportunities for persons with disabilities. And then I will take you through how the Commonwealth Fellowship has impacted in my life, and also have impacted in the lives of persons with disabilities that I've come in contact with. We'll go through how an organization, which is the Center for Employment of Persons with Disabilities, was established, and a number of initiatives that we have embarked on. We'll look at lessons, reflections, and we'll see what we'll be doing going forward. And then there will be a section where you will ask all your questions, and then I will attempt to provide answers. So thank you very much once again for joining. We'll zoom in straight. As a matter of introduction, and so my name is Alexander Kojo Tetteh. I am a disability inclusion specialist, a person with disability myself, a wheelchair user. I work a little, but not so much. Otherwise, I will fall. So I'm comfortable with a wheelchair, so I gain my confidence. I'm a social entrepreneur, and also from Ghana. I'm the founder of the Center for Employment of Persons with Disabilities, an advocate on economic development, and focused mainly on employment, entrepreneurship, agriculture, and policy inclusion. My lived experience have actually shaped my commitment to ensure that our systems came to the benefit of persons with disabilities. In fact, I can tell you that the Commonwealth Professional Fellowship, which I had for just 3 months, has really impacted in my life, and has brought my leadership qualities really out. It actually exposed me to the global perspective, and has really given me the confidence to lead on a number of things. I also gained the opportunity to be able to participate in the UN conference in Addis Ababa. It has strengthened, brought commitment to practical local solutions in Ghana. And of course, I didn't behave like other people, but I was committed to return to Ghana to impact life with all that I've been able to learn. Okay, so all that we'll be doing, why it matter to talk about disability inclusion and economic development. A few statistics here. The World Health Organization estimates over 1.3 billion people globally live with some form of disability. Many of these lack education, jobs, and finance. Disability inclusion is very important. It enhances development and improve on your economic well-being. The World Health Organization and also the UN also estimates about 200 to 250 million Africans live with some form of disability. And inclusion development cannot happen when people are left behind. Remember the UN mantra, which is leave no one behind. So challenges facing persons with disabilities, barriers in education, inaccessible educational infrastructure, healthcare, legal and policy framework exist, but implementation is a major gap, is a major issue. I mean, in Ghana, we have a slogan that we have the fine laws, all the laws, but they are on the shelves gathering dust. So persons with disabilities face poverty, stigma, limited access to which actually hinder their inclusion. Disability rates keep rising due to poverty. You know, poverty leads to disability and disability leads to poverty. That statement has to be changed. There's conflict, especially when it comes to the sub-surrounding Saharan Africa, and there's a lot of accidents. And I can tell you that, in fact, people become disabled now through accidents. Accident is a major contributing factor in getting people becoming disabled because our roads are poor, our drivers drive carelessly. There's also poor healthcare systems. Of course, if you are not able to get the right medication, you end up being disabled. We have an aging population, and sometimes I tell some of my old colleagues that if you are not disabled, old age will make you disabled because you definitely sit in the wheelchair if you live longer. So disability matter, it concerns everybody. Inadequate maternal health care, and also disability affects people, women differently, the older people differently, and also those in the rural areas face different challenges. And so these are the UN Sustainable Goals that relates to what we are going to talk about. Thank you. We'll continue. The Center for Employment of Persons with Disabilities is the main driver of all that we've been doing in the 19 years after I left the UK in 2007, 19 years now. And so in 2007, after I left the UK in 2008, the Center for Employment of Persons with Disabilities was formed. It promotes access to decent work and entrepreneurship. It supports economic empowerment for persons with disabilities. It focuses on advocacy and skills training and policy engagement, working towards inclusive economic participation. And so CEPD, this is the brand. This is our logo, just to make you sure that each time you see this logo, we are talking about the Center for employment of persons with disabilities. This is what the center has achieved so far, which it was empowered by my encounter or my time with the fellowship in the UK. So we have been able to pioneer disability employment advocacy in Ghana. In fact, CPD was the first disability organization that was solely focused on the employment of disabled people, influencing national disability and employment conversation, supporting the passage and implementation of the disability policies, facilitating direct employment opportunities for persons with disabilities, changing employers' perception about disability, building employability skills for thousands of persons with disabilities, and promoting entrepreneurship among persons with disabilities. So we went ahead with advancing disability inclusion in the corporate sector, ensuring that not only governments, but the corporate sector also take disability matters very serious. National awareness on creation and media engagement. Promoting inclusive economic development, supporting sports, arts, and creative talent development. You know, sports is a big issue in industry now, and persons with disabilities are not left behind. They are also taking their share in that, becoming a recognized voice in Ghana's disability movement. When you come to Ghana and you talk about employment for persons with disabilities, CPD would definitely be mentioned. So in terms of influencing national disability policy and employment conversation, CPD advocate for employment quotas at the workplaces, ensure that workplaces are accessible to persons with disabilities, ensure that there's equal opportunity for persons with disabilities, and public sector recruitment becomes inclusive. In supporting the enactment and implementation of disability policy, the center led advocacy in implementing the Act 715 and advancing inclusive policies and labor protections. You know, Act 715 was enacted in 2006, but implementation has been very challenging. And so the center also contribute to ensure that it's implemented. Also, the center is a member of the technical committee for developing the amended act. You know, we started the process of ensuring that the Act 715, persons with disabilities, is in tandem with the UN Convention on the Rights of Persons with Disabilities. Because if you compare the UN Convention and the Disability Act, there are a lot of gaps. So we initiated a process of, together with other disability organizations led by the National Council on Persons with Disabilities, we initiated a process of developing an amended act, and CPD is a member of the technical committee. We also serve on the committee that has developed the employment policy for persons with disabilities. We are a member serving in that committee as well. Facilitating direct employment opportunities for persons with disabilities, CPD has facilitated over 3,000 employments for persons with disabilities. And these are the organizations that we partnered with to provide such employment opportunity. We have the Youth Employment Agency, YEA, The Ghanaians will tell you this organization keep changing its name from government to government. It was formerly DIDA and went and changed to YNA and is now YEA. So we have local government service. We also partner with them. Local government service oversees the activities of the district or metropolitan, municipal, and district assemblies. And so we partner with them to recruit persons with disabilities. We have the Controller and Accountant General, and then we have Ministry of Sports and Recreation. Some of our people have been recruited as coaches and sports development officers in some of the districts and also the National Sports Authority. I mean, private companies and private corporate organizations were not left. Organizations like Amalitech has also engaged persons with disabilities. They are very good, and we are engaging them further. Cummins Ghana has also taken on board some persons with disabilities. MTN and ESL Ghana have all been partnered with recruit persons with disabilities. Promoting entrepreneurship among persons with disabilities. And so we realized that the employment, the formal employment space is quite challenging. And so persons with disabilities all need to jump into the entrepreneurship wagon and be able to, I mean, take their life into their own and do business, own business. And so CEPD went into training disabled people and ensuring that they have the capacity to run their own business and be their own boss. And so we've trained over 6,000 and still counting into entrepreneurship. And so we went further to put them together as a network and called the Ghana Chamber for Entrepreneurs with Disabilities. And we also partnered there with organizations like Ghana GEA, Ghana Entrepreneurship, Ghana Enterprise Agency. Ghana Enterprise Agency supported some of our people in terms of training, capacity building, and also with grants and some loans to do their business. Maro Capital is a financial institution that has also supported our people with training and with loans to do their business. We have MTN and InnoHub. These two organizations also partnered to offer training and support in terms of finance to do their business and also to make income. And so this organization is supported with market access. You know, you can produce all the things, but if you are not able to get anybody to buy, it becomes a liability. And persons with disabilities, if they are not facilitated, if they are not supported to get market for their products, it can be very challenging because people will not patronize your products because sometimes they feel that you are disabled and you don't produce quality products. So, you know, the stereotype and the superstitious beliefs and some are cultural beliefs that we are grappling with. We also support persons with disabilities who are doing their own business, who are entrepreneurs with trade exhibitions to be able to get connections, get networks, and to be able to sell their products. We also have the e-commerce platforms where persons with disabilities producing items can upload the items to the global world to be able to attract market. And the center have what we call the CEPD marketplace, where it gives opportunity for members to advertise their products. We are in a digital world, so we cannot be left behind. So we train entrepreneurs with disabilities to have the digital skills and also business management skills to manage their business very well. Business principles are business principles. It doesn't matter whether you are a person with disability doing business or not. It applies to everybody. If you don't manage it well, your business will collapse. And so this is a picture of an entrepreneurship, promoting entrepreneurship in fashion industry. So you see me there in the middle in my wheelchair, facilitating a section where participants are busy doing their learning. So it's just to bring you up to speed. And you can see behind my back a banner, make fashion inclusive. So this is a project supported by GIZ to train persons with disabilities to have fashion skills and also to live on and operate a fashion business. And so this is just a picture to bring you to what I'm presenting. Now, and the next point is about promoting inclusive economic development. CPD contributes to ensure that there's inclusive economic development, that we are not left behind in the whole discussion. So inclusive entrepreneurship, accessible infrastructure, inclusive education, social protection, and also labor market reforms to ensure that labor market reforms to accommodate persons with disabilities. And so we talk about sports, arts, and creative talents development for persons with disabilities. And most of our people engage in sports. Some have won awards and to the nation, Ghana. We have the wheelchair basketball team. We have the Ghana amputee football team that have won the African Cup in 2004, 2014. I was the chairman of the national amputee football team. And so we have sitting volley, we have sitting wheelchair boxing. So persons with disability participate in all kinds of sports to as a economic activity and also as a recreation. And so persons with disability engage in music. We have a lot more persons. We have Frank Mensah, which we call Pozo. You know, Pozo is now a bit retired. And so we are members are drawing inspiration from Pozo Ace to also have some skills and have something to live on and also make a livelihood. We have a number of people also into the dancing act who provide dance at events, creative initiatives to support persons with disabilities. So this is a picture of my team, my wheelchair basketball team. We are 5. You can see me in the middle in the wheelchair. So this is a wheelchair basketball. We train every Saturday at the Lebanon's Club House. This is an activity and that we are engaged in also to entertain ourselves, to keep us fit, and also to make a livelihood. And so CPD went ahead to have the Beggars initiatives called the Disabled Beggars Rehabilitation. And so if you come to the streets of Accra and most of the major cities, you have persons with disabilities begging. It's not only, let me correct this point, but it's not only disabled people that beg. You have other people, able people begging. But persons with disabilities begging is very alarming, and we need to do something about it. So in 2013, CPD initiated a process of forming the Disabled Beggars Rehabilitation, which we organize them. The main purpose is to discourage begging and to get them into meaningful economic activity so they can focus on skills development, so they can become self-reliant. They cannot depend on people throwing coins at them. They face a huge challenge on the streets, hazards. Some get sick more often because, I mean, the fumes from the vehicles, and some spit at them and all kinds of things. Actually, it's not dignified to beg on the street. And we have organizations supporting us like the Pentecost Church and the Charismatic Evangelistic Ministry, CEM, supporting us to be able to embark on this. I must confess that we didn't have much support from the government. It's so sad, but initially when we started, the plan was that persons with disabilities begging on the street should go back to their various districts so they can be supported from the Assembly Common Fund, but that couldn't really work. So we're still pursuing and ensuring that persons with disabilities begging on the streets becomes the thing of the past. We also initiated an annual distribution of relief items. I call it livelihood items, and also assistive devices for persons with disabilities. You know, it's fine. It's fine to do advocacy at the policy level, but it's equally good to, to merge it also with the service provision, ensuring that persons with disabilities are impacted directly from some activities. So in 2015, the Charismatic Evangelistic Ministry partnered with the center to bring what we call the Day of Help for persons with disabilities. And this is an annual event where there's medical screening, there are surgeries, and referrals. I mean, this happens in a day, just a day. So persons with disabilities gather from all districts, all districts, and they come and get all these things: food items, medicals, assistive devices, and the word of God is also preached to them, and then they go back. So the program starts like 6 o'clock. By 6 o'clock, members are there, and by 3 to 4, we are done, and everybody takes their vehicle and go with their items and go back. This happens annually, and it goes region by region. Averagely, we are able to gather about 12,000 persons with disabilities at the goal. And the Charismatic Evangelistic Ministry, CEM, is able to provide them all these items. And everybody that comes on the venue is able to take something home. This is a fantastic program, and it's like a festival for persons with disabilities in Ghana. Thanks to CEM for this wonderful partnership, wonderful job. Reverend Steve Mensah, Reverend Stanley Mensah, acknowledge your valuable contribution to the disability community in Ghana. So this is just a picture of the day you have a wheelchair user grabbing his mattress with other things. We have volunteers that a volunteer is attached to a person with disability, and so there's no challenge at all. This is the poster of the program that happened just last year. This year is coming on at Kofodia for the whole of the Eastern region. So they will come, every district will come to meet at a point. So this is how it goes. CEPD also went ahead to form to have the Farmer with Disability Initiative. So we call it the FIDA. The FIDA is the Disability Inclusive Farmers Association. These are disabled people who are into farming and who are brought together so they can promote inclusive agriculture. Get the support that they need in terms of their farming and also in terms of selling their products. And a lot more disabled people have joined to go into farming because they can see that there's support for them, and it's better to do farming. And also sometimes you find disabled people doing some work, but they equally want to add some farming to it, and also contributing to the food provision in the country. So we have the Farmers with Disabilities Initiative. Lessons, reflections, all that we've talked about, you could see that disability inclusion is actually an investment in human potential. And so if you create an inclusive environment, you ensure that persons with disabilities are not a liability, but they become assets and also contribute to economic development of a country. Everybody benefits when there's disability inclusion. Policies require practical implementation. We can develop nice policies and laws, and they will be gathering dust on shelves. We need to implement them. Implementation is key to bring to light what the intention of the policy is about. And persons with disabilities must be involved in decision making. If you involve them, they are able to contribute how programs can best cater for them. In fact, my lived experience as a person with disability has actually shaped my focus, or has actually made me commit to ensuring disability inclusion and develop a number of initiatives. Of course, I didn't tell you, but I grew up in a slum at a town in Ghana called Ashaiman Tulako. For some of you who are Ghanaians know the place. It's not a good place at all, but as a person with disability, you have to live there and struggle. And I made a pledge that I will not allow other persons with disability to go through the struggle that I've gone through. And now there are two key things that brought us where we are, and that's brought success to us. As a strategic key things is partnerships and volunteerism. Partnership, all that we did is partnership with organizations. Sometimes we don't get the cash, but we partner with them to provide the item, and that is great. And people volunteer, people are willing to volunteer. We should be intentional to rope on volunteers to assist persons with disabilities. Call to action: invest intentionally in disability inclusion. We should be intentional in ensuring disability inclusion. We should create accessibility and an inclusive system, and that no one is left behind, that persons with disabilities have talents, have potentials, and they can contribute. Entrepreneurship support and employment opportunities make persons with disabilities gain their dignity, contribute to society, contribute to community, contribute to the country. Include persons with disabilities in policy planning, because of course we are part of the citizenry. So why will you leave us behind when you are planning? You need to involve us during the planning stage, so that when it comes to implementation, there will be no challenge at all. Transformation is possible through opportunity and determination. In the Commonwealth, professional fellowship has really given me the opportunity, and I'm also transforming Ghana with what I've learned. Of course, a few people that we have provided service with, and also the policies that we have contributed shaping Ghana's landscape as far as disability employment is concerned. So the Commonwealth Scholarship Commission's investment must bring local transformation to our respective countries, especially in Africa. So, and this is just an encouragement to scholars, alumni, that whatever you learn up there, come back and develop your community. And so my closing message is that disability inclusion unlocks economic potential. It unlocks economic potential. There are great persons with disabilities who are entrepreneurs who are making a lot of income. And some call me Mr. Tetteh. I can contribute to this program that is coming up, and so it's making it great. Instead of they sitting for people to give them donation, it's changing their mindset that they need to be self-reliant. And so the CPD is and the center and Ghana Chamber for Entrepreneurs with Disabilities and the Disabled Inclusive Farmers Association, and all this initiative is to ensure that we move from the charity model to a model where we are economically empowered to contribute income, to contribute to society, to contribute to national development. So my journey actually demonstrates what I'm talking about. Expose opportunities for persons with disabilities, and they'll be empowered to do what I'm able to be. You can imagine if I was not given the opportunity to travel to the UK in 2007 to work with Radar, Reemploy, and other organizations. I got exposed. In fact, at a point in London, I was part of the campaign for the independent living. I mean, we staged a very huge campaign. So it shaped my perception, and that drives me in all that I do. CEPD can do more. We need your support. We need your support in whatever way possible. Organize individuals, NGOs, the Commonwealth itself. In fact, the vision must be alive, and we want to continue to sustain the projects and initiative. We want to do more. We will need your support. So this is our contacts. I would say here that I would thank you so much for listening, and I will leave the space back to Eva for questions, any question that you might have. Thank you very much.
That was amazing. Thank you so much. You can see all the reactions going on the screen. Thank you so much for sharing your lived experiences, Alexander, and also your work in leading and advancing, rights for persons with disabilities in Ghana and beyond. I'm sure there will be a lot of questions coming through. There are already questions coming through in the chat box. But I would like to thank everyone who shared questions via the registration forms. So I would like to start with those questions first. And then, of course, I will come to the chat box questions. Alexander, so if you're ready for the first question.
Yes, I'm ready. Thank you very much, Eva.
Great, wonderful. So the first question is, how can policy improve the disability-friendly environment in local communities?
Eva, thank you very much, and thank for the one who asked the question. Very important question. In fact, policy is the beginning. Policy policy sets the framework within which one can operate. And policy also give room for advocacy, to bring accountability. And so policy is very key. But policy alone, somebody would say, don't bring food on the table. Implementation is the further. Thank you very much.
Amazing. Do we have a global inclusivity policy? Or currently, like, what is the scenario with inclusive policy? Is there something like a global framework, or um, what has your experience been in terms of inclusive policy?
Okay, so thank you. In fact, I don't know about any global inclusive policy, but of course, what we all draw inspiration from is the UN Convention on the Rights of Persons with Disabilities, which was enacted in 2006. And so, but each country has its own inclusive policies, and each region also have its own inclusive policies. I can talk about the African Disability Protocol, which came to force into 2024, which was enacted in 2018. Ghana is yet to ratify it anyway. And so that is what I can say, but if you want to see anything about inclusiveness from all sectors, the right place to go is the UN Convention on the Rights of Persons with Disabilities.
Yeah, that's true. Yeah, thank you so much for your response. Um, Speaking of policy, you've spoken a lot about policy implementation and how that is important. In terms of politics, how can we achieve adequate political inclusion in terms of candidacy and the appointment of PWDs in Africa?
Sure, politics in Africa is a big thing. And I think politics in developed countries like US and the UK are different from politics in Africa. So I think that for persons with disabilities to strive in Africa, you need to be part of it. You need to join the political party, contribute like everyone. And so when the time comes and you vie for a position, you'll be voted upon. So if you are a person with disabilities and you have the capacity to become the president of a country, it just don't happen. You will not be voted because you are a person with disability. Sympathy vote alone will not make you president. You need to join the political party, contribute your quota, contribute your strengths, and then when it comes to your turn, you can contest. And there will be a few discriminating here and there, but you'll be able to fight it, just like we are fighting all barriers within the system. And I think that I'm looking out for Kenya to have the first person with disability as president. Thank you very much.
Perfect. Thank you so much, Alexander. Um, Looking at the questions in the chat box now, there's a question from, I think it's Frederick. Um, do you have individuals with autism spectrum disorder that you are supporting or you work with in your work, at CPD? If so, how do you manage their transition, sensory and behavioral challenges in the workplaces?
Yes, thank you very much. We work with them. We partner with organizations. We have the Inclusive Family Alliance. Actually, I'm a board member for that organization. One icon, Hannah Awazi, who is doing a lot of things in that space. You have Farida Bedio, who is also a very strong advocate in that space. Yes, when it comes to employment for autism and cerebral palsy and the spectrum, it depends on the level. So when it goes to when it's we have the medium, mild, and I think we have three categories. We have the mild, medium, and extreme. So when it goes to the extreme, there is a bit challenging. But we have people who are autistic persons who are working very fantastically in their workplace, who are doing business on their own. Farida is a great example. There are others up and coming. I have Peter Alabi in Nwa, who is also has a cerebral palsy. We have others who are autistic who are working. Yes, so we work with them.
That's some really good insights. And of course, Frederick, if you'd like to get in touch with Alexander and discuss this further, please
Yeah,
feel
that would
free
be
to get
great.
in touch. We will share your email address in like the final slide later. Um, The next question is from Maureen, and the question is, to what extent have the government policies been PWD focused in terms of education support, political and economic opportunities, and empowerment in Ghana?
Sure. Thank you very much. And thank you for that question and the questionnaire. Yes, the government has been very supportive when it comes to education. Now in Ghana, we have free tertiary education for persons with disabilities. Of course, the basic level is also free somehow. And so when you finish your basic, going to the university is also not a wahala. And so you have persons with disability make a troopy in education sector. What we haven't been able to do yet, or what government haven't been able to do yet, is the private institutions or private universities to pay fees for those who attend the private universities. But once you are able to get admission with the public universities, your school fees is assured, or scholarship is given to you and you go free. Employment, government have come out with a 5% employment quota for persons with disabilities in both public and private sector. Of course, this is government statement. Somebody will say is a political statement, but we and the practitioners and the advocates in the space are going ahead to develop a policy to run this initiative by the president. And so that is what I mentioned, that the Ministry of Labor, Jobs and Employment has come out with a committee and that is driving developing an employment policy for persons with disabilities, for which I am a member. Thank you.
Thank you so much. You mentioned about supporting PWDs in the fashion industry. So there are a couple of questions. The first one is, are there or is there a particular group of people with disability that are being targeted in the fashion designing training? Um, the second question is, what mode of teaching approach is being used? And then finally, how is impact being measured?
All right. So the fashion industry or the fashion trade is a vast one. It's a vast one. We have the garment making, we have the bead making, we have the headgear, the minerary. And so it depends on your category of disability. Of course, the blind can do the beadwork perfectly when they are assisted, because the fashion also have to do with colors, and so it makes it a bit challenging for the visually impaired. But for all other category of persons with disabilities, we are able to get them to be trained. What happens is that we advertise these opportunities within the platforms, and those who are willing and have the passion for it taken on board and are being trained. So the training is both here in Accra and also in Kumasi. The next will be shifting also to the northern regions, will be sited in upper East region. Thank you.
That's quite interesting. Thank you for sharing that. Um, so you mentioned about the annual distribution day, and one of the services that was mentioned was the surgery. Um, are surgeries performed on the day itself, or are those in need of surgery registered on the day and then attended to later?
Okay, so surgeries are registered before. So we send information out to all the districts, and so this is what happens. We work with the social welfare directors in every district. So before the day comes, we have a couple of meetings with the social welfare directors from each district. Okay, we have a meeting together, and then we tell them if you identify anybody who needs a surgery on these dates, let the person come and register. And so when the person comes and registers, we look at the type of surgery. If it would need a major surgery, that person is referred to the hospital, especially the teaching hospitals, for that surgery to be done and borne, and the cost is borne by the church. But if it's a minor surgery, that surgery will be done on site, but not on that day. Not on that day. On that day, it's too busy to do a surgery, and so surgeries are done before the day. What basically we do on that day is to do screening, and we do screening, and when we identify any person that needs further surgery, referral is given additionally. And so distribution on that day, we do distribution of items solely.
I hope that response was useful. Um, there's a next question on how does the CPD facilitate the employment of young graduates? I'm assuming they mean by young graduates who have disabilities. Uh, so in your experience, how or like through your work, how do you facilitate employment opportunities for young graduates?
Yes, so it makes, for young graduates, it's very easy. It's very easy. We partner with the institutions, and also persons with disabilities form associations in these academic institutions. So we liaise with their presidents, the leadership, and so when they graduate, we still have contact with them. When there's an employment opportunity, we link them up. Of course, we have a platform where we have most of these graduates who are on it. So when there's a job opening, we place it there and support them. Yeah.
Great, thank you. So next question is it's concerning two different groups. Um, so hopefully I'm able to ask that question the way it's framed. What caregiving strategies and policies have you been assisting for the first group, which is the elderly, especially those who have become disabled due to an accident or because of late onset illness? And the second group is for person with disabilities who are non-verbal and limited capacity for sign language communication. So these are the two different groups. There's a following question to it. Do share any best practices within the home or at national and or continental level, as per your experience.
Thank you very much. And I would love to, this question is fully packed. I would love the person to have my
It is,
contact so
it is.
we can actually share.
Definitely. And I
But
will share your
for the,
email address in the chat box as well. There have been quite a few requests about your email address.
exactly. So for the aged, we have the Common Fund for Persons with Disability, the District Assembly Common Fund for Persons with Disability in every district. And this is a fund that comes from the central government, and that is given to every district. But the fund is not enough, actually. And so at a time, it's not able to cater for all the needs of disabled people within each district. So what the district assembly does is to group disabled people into badges. So when the funds come, the first badge takes, and then it goes to the next badge, and then the next badge, and then the next badge. So that is how support is given. And the fund, you can't move from one district and go and get a fund from another district. It's not part of it's against the law. And so this is how we deal with them. Sometimes, persons with disabilities and also the aged, the difference is very slim. You see an aged person, he sits in the wheelchair not because he's born disabled or had an accident, but he's old. Okay, so we handle it case by case basis. We don't totally rule out. We look at the person's livelihood status. We look at the support systems for that person. If that person really needs some support, he will be given. He will be given because the old age has made such a person disabled or has put him in a disabling situation, a condition. That person need to be supported. That is our policy. I can't remember the next question you
Um,
mentioned.
yeah, so it was about any best practices. Um, you talking about are you asking about the next group or the next follow-up question?
No, not the next one. The question you asked was a two-part question.
Yes, so it was the second group was person with disabilities who have non-verbal and limited capacity. The follow-up question was any best practices that you could suggest within the home setting or at national or global level.
Okay, so share my contact with them, and then I will
Yes,
share further. But
definitely. I have shared Alexander's email in the chat box, so please feel free to make a note of that, and then of course reach out to Alexander to continue this discussion. Um, Conscious of time, but
Eva, let me just mention that an organization called Amalitech is also supporting persons with disabilities who are graduates. So in Ghana, when you finish university, you have to do your national service.
yeah,
So this organization is getting all persons with disabilities who want to do national service and to support them, to train them so that they can transition into work. Thank you very much. I wanted to just mention this.
that is interesting. Thank you so much. Um, it's not a question, but someone in the chat box has mentioned about um, if there's someone from Ghana, please do share the name of a university in Accra with good disability services or programs. They, I think, are at University of Namibia and would like to uh, maybe have some knowledge exchange and learn about any good templates or framework that are
Okay.
Africa friendly. They've also shared their contact details. So please,
Right.
if you are working in the sector, of course, you can also reach out to Alexander. But if there's anyone else working in the sector or have any information about this, please do connect with them or in the chat box. They have provided their contact details. Um, Conscious of time, but I'm still happy to take a few questions. Um, Are there any programs for combating the existence of the charity deficit or medical model of disability?
The, are there
Are there any
programs?
programs to combat the existence of the charity
Mhm.
deficit or medical model for disability?
Okay, so yes, so we have the charity model, which is I mean, giving out arms and items to persons with disability. It hasn't developed disabilities potential to be self-reliant. And then we have the charity model, which see disabled people as sick people. Yes, but there are programs to empower persons with disabilities. There are programs to see persons with disabilities as not the problem, but the problem is the system.
Mm,
So there are programs, there are campaigns to ensure that uh, we don't continue to create disability, because
mhm,
we believe that not the disability is not us. The disabling condition is not us, but
mm,
it is the environment. So once the environment becomes inclusive, accessible, I mean, we don't see the impact. Our disability don't impact so much on us. So there are programs, there are sensitizations, educating the public and policymakers that once they create an inclusive environment, it will be inclusive for persons with disabilities. Yes.
All right. Um, Maybe I'll take one or two more questions and then we can move to the networking session and we can have further extended questions or discussions there. Um, do you think that even though many policies and NGO programs exist, the real resources needed for inclusion are still missing in practice? For example, in many African countries, roads and other infrastructure projects are being developed, but they often fail to include basic accessibility features such as pathways or guiding surfaces or safe crossing systems for visually impaired people. Doesn't this show a gap between policy commitments and actual implementation?
Yes, I agree with you. But to achieve a total inclusive society will not take a day. It has to be consistent. I think that UK, US, Denmark, I mean, those are the places I've traveled to, and Italy, began way, way, way back.
Mhm.
And so the movement have to be alive. We need to continue the advocacy. We need to continue the sensitization. We need to continue to hit on policymakers and the nation builders that they need to ensure disability inclusion. So there are still gaps, and back in Ghana, and there are still gaps, but we are moving on. We are moving on. A few things are changing. There are
Mhm.
places now you go, the place is accessible. Ghana has now accessibility standard. Ghana has a accessibility standard, which developers draw inspiration from. It will not take a day. It will take consistent campaign.
Mm. Um, and you've spoken about, you initiated CPD after your soon after your fellowship. And you've started these initiatives and different programs. After so many years, do you have a plan to scale the programs that you've been working on? And there's also a comment or question, I think, about do you have plans to extend your programs or services to Asian countries like Pakistan?
Yes, of course. In fact, not Asia for now, but my first goal is to be able to move to other African countries. But of
Mm,
course, if an invitation comes from Pakistan, because it's also about the local people, it's
mm.
about people who are willing to embark on the journey that I have embarked on. So if Pakistan, the community, there are people who are willing, I am ready to support. I mean, the investment that the Commonwealth has given to me is not for me alone. It's for the world. And I'm ready to share the initiatives, the learnings, the challenges that I've gone through with anybody and any country.
Yep, across Commonwealth, this is the
Across the
reason we
Commonwealth
have.
countries.
Exactly,
Exactly.
this is the reason we have these webinars. It's a great platform for scholars and alumni to network and connect with each other. All right, I think one final question. Um, how is CEPD working together to gather data and support children with disabilities to ensure that no one is left behind from school education? Does CEPD take part in curriculum development through any of your programs?
Yes. So in terms of data, we work with the social welfare directors from each district. So everybody in Ghana fall in one district or the other.
Mm,
And it's the mandate of the district assembly to collect data. So they collect the data and we work partner with them to identify the children who falls under them and give them
okay.
access to education.
Mm,
Um, yes, we work with the National Curriculum Development Commission, and CEPD is a member of we call it NACA. It's got the National Assessment and Curriculum Commission. So we are a member of that committee.
amazing. I think with this we'll end the Q&A session here. But then please do, if you have time, please do stay back for the post-webinar networking session. But moving to the next slide, if you would like to connect with Alexander, please do reach out to Alexander. I have already shared his email address in the chat box, which will also be on the screen. Alexander, if you can move to the next slide, please. Yes. You have his email address on the slide as well. Please do reach out to Alexander to connect with him, ask questions, take the discussions forward, learn more about CEPD's initiatives and different programs. And yeah, just connect. If you're from Ghana, if you're from any other African countries, or if you are working or conducting research in this space, please feel free to connect with Alexander. Alexander, any final thoughts before we move to the next networking session? Uh, I'm not sure if you've had a chance to look in the chat box, but we have received uh, quite a lot of positive responses acknowledging and appreciating your webinar presentation. So thank you so much for your webinar and thank you so much for sharing your work. Any final words before we end this webinar?
Thank you very much, Eva, and thank you for the Commonwealth for the opportunity. I would say that I'm who I am because the Commonwealth has given me this opportunity, and I'm ready to share and partner with any organization that we can work and extend the inclusive society for persons with disabilities uh, across the Commonwealth. Across the Commonwealth. Thank you.